Altogether Better is a regional programme funded by the Big Lottery. Across the region we have 16 projects, and within those 16 projects we have over now 14,000 community health champions, and in turn those health champions are helping over 85,000 people. Our funding is linked to three main themes, which are improving physical activity levels, improving healthy eating and improving mental health. But what we're also finding through our evaluation and our evidence building activities is that we're having a much bigger impact on social capital, so on the networks that people have in communities, the way people get along with each other. So we're very much about an empowerment model. We're about empowering individuals in communities to make changes for themselves and for their friends, families, communities. And we've got lots of evidence that that's happening at an individual level and a community level. And those provide a really robust kind of background for our approach, so that when funders and policymakers want to know, well, you know, what difference does your approach make? We have the evidence there.
In Sheffield, one of the main drivers that led to the creation of Health Champions was this recognition that actually most of us have got quite a good understanding about our own health and well-being, and that our engagement with health services often disempowers us. So a feeling that actually if we could work more closely, particularly with people from what we call disadvantaged communities, people who are experiencing health inequalities, actually working with them more in a partnership way, offering them knowledge and recognising that they could be powerful themselves, could be a much better way of delivering health services than just expecting people to go to their doctors and get advice and then go away again.
And this is where the health trainers work. They kind of ease people in to what's going on in the area, they help them, they support them, they raise their self-worth so that they are then able to take up services that are around, or to engage in their medication, their treatment and so on.
There's a new study which is a commissioning guide. It's an NHS study of 140 something other studies. And what it's saying is that if you don't have that social contact and connection, it's as bad for your health as smoking 15 a day, having a problem with alcohol, having a problem with obesity. So it's really quite key that this evidence is coming forward so we can demonstrate that how we deliver makes a huge difference to their health, and it's not just about the lifestyle changes, but it's making those social connections with your friends, with your family, and importantly with that wider community.
The consortium provides support to the 19 host organisations. They do the recruitment of the health champions and the delivery. We provide them with the support that they need and also bring them together to share ideas about how the programme might develop.
The reason why the Health Champion Scheme's worked in Darnall is because it's an integrated sort of community approach to health. It's been a brilliant way for Darnall Wellbeing to get to know more about what the community needs. It's a way of reaching out to sections of the community that we might not otherwise do, and that works really, really well in spreading like positive health messages.
What health trainers and health champions do is they build that bridge back into those communities. And it's not just an instrumental way. It's not just saying, well, you've got a task to do, go out and do it. It's a genuine attempt, I think, to establish an ongoing relationship with people and a reconnection with communities that we, to some degree, as professionals and as the health service, have ignored and have tended to. The only relationship we've ended up often having is when people turn up at their doctor when there's a crisis.
I think the programme's been so successful because of the way that we've opened it up to local people and let them say the kind of things that are needed, really. We've provided that structure, the resourcing for training and so forth, but it's been very much their ideas, and we've just seen this incredible enthusiasm and collected a whole lot of stories of people and the changes that they've made for the better, and they're just passionate about telling other people about what they've been doing.